Good evening, friends. My name is Dr. Sandeep Dewan, and today we are back with another session of Facebook Live. Today we'll be talking about training in critical care medicine. Critical care medicine is a branch which deals with all kind of sick patients, right from head to toe. It is a branch where you need to learn all organs of the body, and we are trying to save one of the most critical patients that ever the medicine can bring us. The branch has come a long way as part of medicine. There were days when it was very much as part of the anesthesiology department long years back, but with more and more doctors practicing critical care as a specialty, it has now bloomed in the last 15 years. Most of the hospitals now have separate critical care departments, and the branch has come a really, really long way. In the last 2 years, when the COVID pandemic hit us, the most important things that were actually in demand were ICUs and oxygen beds. Similarly, the trained critical care physicians were also in great demand. What we learned during the last 2 years and during these waves of pandemic is that emergency medicine and critical care medicine is something which should not be restricted to only the elitist of doctors. Personally, I feel that even every MBBS graduate who is coming out of a medical college should have a basic knowledge of how to manage major emergencies, should have a basic knowledge of how to manage critically ill patients. Unfortunately, at this point of time, our curriculum is not robust enough for managing emergency medicines and critical care as part of the MBBS protocols or syllabi. In during MBBS days, we are not taught about the golden hour protocols. They need to be learnt. They need to be practiced. Critical care is a branch where you can just not mug up and practice. You have to be really practically up to the mark. So that is why training in critical care is not only lengthy, tough, but also full of challenges. So there are various courses in critical care which are there practiced by the Ministry of Health. We have DM in critical care. We have DRNB critical care. There are fellowships in critical care, but it is still these seats are still far from what is needed in India. That's why it's important that we have short courses, short trainings, online courses, fellowships in critical care so that the critical care can reach the masses. The reason being, the emergencies in tier 2, tier 3, tier 4 are of equally importance. But unfortunately, specialist senior doctors are not available in the hinterland of our country. And those who have done the higher degrees in critical care are mainly practicing critical care medicine in metros. So what happens to our patients in the smaller cities? That is why simulation based trainings for MBBS graduates are extremely important. What is simulation based training? A simulator is a mannequin, just like a human being, which responds, which talks, which responds to the various emergencies. We put students in those scenarios and the students respond to those emergencies. For example, we can create a patient who has come with a trauma and we give that case to 4 students and they are expected to manage that case. A team of faculty is noticing their points, what they need to do, what they did well, what they did not did well, and after some time, after a few minutes, which is approximately 20 to 30 minutes, we actually deliberate on the same scenario with those students. So it's a practical training. Once you have practiced that simulation scenario, it is very, very difficult to forget. It is known in medicine that what you do, you remember. But if you only read, you cannot remember all of it. 70% of that is lost. That's why simulation based trainings are the new thing in critical care medicine. Students can learn on these simulators. They can make mistakes which they can't do on real patients. We can create even rare scenarios for students which they may be seeing once in a while, and they can actually go into the hindsight, look at their mistakes, correct them, and then move forward. So that is why the whole world has moved towards simulation-based trainings, particularly in the field of emergency medicine. Critical care is nothing less than a warfare, and that is why these simulators have mainly been inherited from the army, where they practice warfare so that they are war ready. Similarly, our critical care physicians, they need to be ready for every emergency, which for which they need to practice again and again on the simulators. Now, as I told you, the emergencies in the deeper parts of the country cannot be managed by specialists because there are no specialists there. We have to train people who have done MBBS and train them well in critical care medicine. And that is why there are two kinds of fellowships which has been started by our society, eNext ICU. One is a basics fellowship, which is a 6-month course, which involves 5 months of online modules and 1 month of practical training in practical intensive care scenarios, which includes live cases, simulation scenarios, case-based discussions, and grand rounds. The basic fellowship is for MBBS graduates who are either interested in taking critical care medicine as a full-time specialty, or those who are already practicing intensive care in their cities, but unfortunately they do not have any structured training. This will be of great help to them. Similarly, there's another fellowship known as Advanced Fellowship course, which is a 1-year course with 10 months of online modules and 2 months of practical training. Similar to the basic course, it is a similar modules but only at a much higher level. The course curriculum is wider than the basic course. The scenarios, the case discussions are more robust, more elaborate. There is more in-depth analysis of every emergencies. That is why the advanced fellowship is mainly for those who are done their post-graduation, who are practicing medicine or surgery, but unfortunately they don't have any training or a formal training in intensive care or emergency medicine. So coming back to our discussion, I would really feel that critical care has now come of age in this country, and we have to create more and more army of critical care physicians who can actually practice intensive care in the smaller cities, smaller towns, rural areas of the country. I can see more and more ICUs coming up in the next few years, but most of them will be coming up in the smaller cities. So if we can create an army of critical care specialists who even if they are MBBS or post MD, but they've done some basic training on a structured training in critical care, they can actually make a lot of difference to the mortality. With those thoughts, we end today's deliberation on training in critical care medicine. Good evening and good night.